Hello, everybody, and welcome to this webinar, which is the Australian College of Road Safety International Outreach Chapter webinar. So my name is Amir Sobhani. I am Director of SafePass Consulting and a member of Australasian College of Road Safety and a committee member for International Outreach Committee. And I'm very pleased to facilitate this webinar today. The title of our webinar is about safety of motorcyclists or the road users on two wheels. We know that currently in Asian countries, particularly Southeast Asia, there are lots of challenges about safety of these road users, and road authorities and subject matter experts, they're working hard in order to address this safety issue. Today, we invited three distinguished presenters from Cambodia, Vietnam, and Malaysia in order to share their experience about this important topic. So I will start introducing the speakers soon. Before we start the webinar, I would like to, announce some housekeeping stuff. So the presentations would be in order of each presenter will do the presentation, and then we will have 5 minutes questions and answer at the end of the session. And once all three presentations completed, we will have 15 minutes discussion time at the end. So hopefully we could keep track of the time for the presentations, and we will have that 15 minutes at the end, and we could have a good discussion together. So please feel free if you have any questions. There are two ways that you can communicate those. There's the chat box that you can communicate your question, and a question and answer box you can see underneath your window. I would suggest I would recommend you to use the question and answer box, because that's the place designed for your questions. If other people like your question, they can like it, and based on the number of people liking a question, the question will come to the priority. So we will ask that question. So my recommendation is to use the question and answer box. But you can still use the chat box if you would like to do any discussion, provide some feedback, and I'm sure even if we do not get the time to get to your questions, so the presenters will spend some time in order to read your questions and just answer while the other presenters making their presentations. So now I would like to hand over to Dr. Shane Turner, the co-chair of International Outreach Chapter, to do the opening remarks. So hand it over to you, Shane, to start your presentation.
Thanks very much, Amir, for facilitating the workshop, and welcome everybody. My name's Shane Turner. I'm a road safety specialist out of Abley in New Zealand, so it's good evening from New Zealand. I know a number of you are in the morning and afternoon. I'm one of the co-chairs of the International Outreach Chapter, along with Mazra, who's based up in Malaysia, representing the Asian part of the group or the chapter, and Gail, based in Africa. And so I'm really looking forward to hearing the experiences of our esteemed presenters in 3 different countries in the Asian region. And thank you, gentlemen, for coming along and presenting content at this webinar. So I'm just going to do a short talk through the Australasian College of Road Safety, giving an introduction to the college. And I know a number of you are members, but some of you may be not members who are just joining this webinar, and also others that might watch it in the future may be interested in knowing a wee bit more about the college. So the Australasian College of Road Safety is a fairly unique organisation internationally, and in terms of its role. So it represents who is the college. It's the peak membership association for road safety in New Zealand and Australia. It has over 1,300 members from 40 countries. A lot of those members are, of course, based in Australia and New Zealand. And really the purpose of the college is to support our members who represent the various areas of road safety. So whilst a number of us might be engineers, we also have a lot of members in other sectors of road safety who are trying to improve road safety, and it enables us to collaborate and work together towards improving safety in our countries, and also providing advice to others in other countries who are interested in the work that we've done. Our vision, of course, is to eliminate the elimination of fatal and serious injury crashes for all road users in our country, ultimately, and again to assist other countries who are having a similar goal. And many countries do have that goal now. And the support we give is through advocacy. So there's quite a lot of advocacy done by the college in Australia and in New Zealand with politicians around legislation and just trying to get more investment in road safety. We host events and we assist professional development. So that's a key role in terms of if you want to develop your skills in road safety, then the college can help you do that through the webinars and through the conference and other means. So our key values and policy is we should prevent all fatal and serious injuries on our roads. That's a key goal for us, and the road traffic system must be made safe for all road users. That's our aim. And system designers should aim to prevent human error and mitigate its consequences. So it's not all about blaming the victims of road crashes, but we have a role in terms of a safe system approach to road safety. And life and health are not exchangeable for other benefits in society. Sweden was one of the first countries that pointed this out, that when we design our roads, safety should be paramount, and we hold that view. And policy positions must be evidence-based. So if you come to one of our conferences or have been to one of our conferences, you'll see a lot of evidence on what can improve safety in each country, not just New Zealand and Australia, but other countries as well. There's a lot of really good quality research done by members of the college. We also have some policy positions which are on the website, particularly around speed management, the system approach to road safety. We do have one on motorcycle safety. It's probably a bit more orientated towards high-income countries, so it probably doesn't cover all of the things that are issues in low and middle-income countries, which will be talked about today. And we even have a policy statement with the link between climate change and road safety. And other position statements are being developed, and if there's an area of interest that's not covered by these, then please contact the college and raise it as a potential area where we need to develop some policy that can be picked up by different countries. We also do a lot of work in the submissions, so there's been some major changes to the setting of speed limit rules in New Zealand, which is obviously of interest to me, which have not been particularly good, where they want to raise speed limits. And so the college has put in a submission on that. And with the recent federal election in Australia, there's also some submissions that have been put in on that in terms of trying to encourage politicians to invest in road safety. So in terms of chapters and networks, each of the jurisdictions or states around New Zealand and Australia have a chapter. So as well as being in the IOC, I'm also part of the New Zealand chapter of the college, and we have these networks. In terms of benefits, the wiki alerts are very useful in terms of looking at what's happening in Australia and New Zealand, and also talks about work that's happening in events in other countries. Like if you've got an event for your particular country that you want to get into the weekly alert, some major piece of action or policy by government, then please do contact the college office and they'll put it in the weekly alert. We've got webinars like today, professional developments, discounted rate for the annual conference if you're a member, and access to scholarships also to attend the conference, and networking with other people working in road safety. So we encourage you to take up all these benefits. We have a webinar library, which you can access through the website if you're a member. Membership in terms of our LMIC is quite reasonable priced, $10 Australian per year. To gain these benefits, you can see what it is if you're actually based in New Zealand and Australia. So it's very good value, and we would recommend that you encourage others that you work with to also become members. If you're a high income and a high income country outside of Australia, though, you have to pay the higher income rates. And this here is just a slide that you can scan, a QR code, if you want to become a member of the college. I'll just dwell on that for a moment in case people are scanning it, and then hand it back to you. Thanks, Amir. And as I said, looking forward to hearing what the three speakers are going to talk about tonight.
Thank you, Shane, for sharing this very great and important insights about the college and the benefits. So I also encourage everyone to just consider the offer for international members. So 10% is just less than 5% of what we pay inside Australia. So that's really bargain. And there are lots of benefits associated with just being a member of the college, which I am just, feeling and experiencing at the moment as a member of the college. Thank you very much, Shane. So we are 3 minutes behind schedule, so it would be good to just start with our first presenter, Mr. Swan Kong. So I just do a brief introduction, then I hand it over to Swan to start his presentation. Swan Kong brings over 18 years of experience in the public health sector. He has collaborated with both public and private sector teams to promote gender equity and women's economic empowerment, as well as to address key issues in road safety and injury prevention, traffic safety engineering, environmental protection, occupational health and safety, agribusiness, food safety, and ecotourism and hospitality industries. He is currently acting as the country representative of Catalyst Plus, focusing on delivering the Accelerating Women's Empowerment Program, a global Affair Canada program engaging high-skills Canadian professionals to provide capacity building for their partners in Cambodia. Before joining Catalyst Plus, Swan worked as a program manager and technical advisor for the United Nations and international organizations such as WHO, GRSP, CampSafe, IARD, IRAP, ISF, and ADB funded project for community-based rural road safety program. He has additionally been appointed as an advisor to the National Road Safety Committee for the Royal Government of Cambodia in the capacity of Undersecretary of State to build strategic project initiatives in collaboration with both national and international partners, as well as the private sector. He is also the board of directors of the Cambodia Honey Association and the director of Asia Focus Countries for the International Safety Foundation, an organization based in Australia. On this note, I would like to hand it over to Swan to start his presentation. I think you are on mute, Swan. If you could unmute yourself.
Okay. So thank you, Dr. Amir, Dr. Sean, everyone. So good afternoon from the Cambodia. Good evening, good morning to the college and all the participants who attend this webinar. So thank you for joining today's. So I'm going to provide the presentation about like the road crash involving with the two-wheel vehicle in the Cambodia with the emerging the safety challenges. So mainly today we'll focus on not just only the two-wheel road user, but specifically for those like among the group of the food delivery. The food delivery is growing rapidly, very popular, but at the same time they have to go with the very high speed and very dangerous. So I'm going to brief about those. So I skip this slide because Dr. Amis already goes through. It's about myself. So, and as everyone know, globally, it's still very high numbers that every year somewhere on the world's road, visiting here more than 2 dies every minute. And it's about 1.19 million deaths worldwide, and it's still to be like the first leading cause of death among the children and young people, and 12 leading cause those among young adults. So it's like the percentage sharing is very high among the middle income country, Cambodia, Laos, Thailand, Vietnam, and others, Malaysia, Philippines, Indonesia. And like in the Asian country, Cambodia and other neighboring country, we are more number of the registered vehicle as two-wheel vehicles. So like if we can see the figure, this is like more than half of the figure globally, but among that, in Cambodia also very high number. And we're talking here today about like the Western in the region, like the Southeast Asia region. It's very high number of the motorcyclists. The rates of the deaths is for the 100,000 population is 21 deaths among those very high. And Cambodia also showing very high number. I will provide a key presentation about the figure in Cambodia. But within that, because like we make some comparisons of the Cambodia's road crash statistic with other country like Japan's in many years ago, that is going to the peak number of the road crash. So if we bring from the 1960 and comparing the figure between Cambodia and Japan, and specifically comparing the Phnom Penh city and the Tokyo, the land, like the area is about 678 kilometers, and Tokyo is 2,000 plus, and the population in the city is quite different. Like in Cambodia, it's about 2 million plus, but in Tokyo is 13, almost 14 million. And the fatality rates very high comparing these two, like in Cambodia 12.4 per 100,000 population, but in Tokyo 1.1. But in the last decades, like 40 years ago, in Tokyo it's happened the same thing, but many intervention, many programs have been implemented since 1960, 1970, so they can pull down the number of the fatality and the number of the injury in overall in Tokyo. Is this Cambodia and Japan, that's the whole country the same. And if I point here, you can see like the fatality rate per 100,000 population in 2020 is 10.9, but the peak, very peak, is around the year like 2019 is the peak. This is according to the data resource from the World Health Organization and the global economy, that the maximum periods for the fatality rate per 100,000 population is very high during that years. It's like it's avoidable everywhere, not just only Cambodia, but in Asian country and in the region. Is avoidable if we can strengthen and put more investment and efforts from the country, from the region, from the global support, that we can reduce and save more life. So this is the fatality rate. I do comparison Cambodia and Japan again. It's the percentage among the motorcycle road users. You can see on the table with the blue one. Is the motorbike fatalities in Cambodia is contribute 78% among the total fatality, but in Japan only 18.5. But in the last 40 years the same. However, they changed from the two-wheel to be more with four-wheel, and the two-wheel still, but with the more safer, with the bigger engine, but stronger enforcement and more comprehensive education on the driving licensing, so they can reducing down the percentage. Just look back to the daily average of the road crash fatality within the 10 years. From the 2011 to 2020s, it's going like it's between 5 to 6 people die in average. It's like a day, and other 16 to 18 people injured. It's seriously injured on the Cambodia's roads. So if we look back into the public health data, we do a comparison between those fatality and serious injuries caused by road crash and comparing with other causes of death. It's even higher, 30 times higher than those die from malaria, dengue, and unexploded landmines combined. So it's very high in this country. Although we, the government and the private sector, the civil society joined the effort to introduce some program, but it's still along the way. When we implement the program, based on my experience, when we have like a 5 years program, and then when we implement that, we can see the number of the fatality caused by overspeeding or drink driving, and helmet use. You can see some increasing rate, and those the death and the injury coming down. But you need to keep going on until it's become like a culture, a complete culture of safety. Otherwise, if you just only introduce very a short term of period, just 5 years or 10 years, it might be coming back to the same things again. So this might be education, enforcement, and advocacy need to be more comprehensive with the engineering component and others. Plus, the emergency response is quite limited in the country. So this is just over a decade that I can show, comparing the 100,000 population and the 10,000 registered vehicle. You can see the graphs that can be shared on the slide. And this is the projection in the last decade. We do the program implementation by the government, the institution, development partners, civil society, some program implementation with the private sector initiative. So we expect to pull down the number that we expect if nothing implemented by the last, like 2020, it will be 3,200 people will die. So we want to pull it down to only like 1,600 or less than that. Although every country I know, we want 0 deaths on the roads. We want to see our road safe, a place to drive safely everywhere. But however, because of the movement of the engines, we try to, but cannot be avoidable in some cases. However, in the action plan, we put like to pull down 50%, and then we can achieve about 62%, just more than half. So out of the people that we expect to save their lives, over 7,000, we can save only 4,561 from the 2011 to 2020. So it's still far beyond. So within the second decade of action plan, we confident at the national level. We developed a new policy and action plan to align with the decadal action plan and the SDG 2030 with the 12 voluntary goal and other targets. So we aim to reduce 50% more of the fatality and the injuries. So this hopefully this like from year to year, from time to time, we can do better because we know it's a big amount of money that vests with the road crash everywhere, like in Cambodia, according to the most recent research by the National Road Safety Committee together with the UNDP. It's lost above over 600 millions a year. So this is a lot. So that's why I mentioned earlier, putting the money into the road safety program implementation is not spending, it's an investment. So like we can save more life if we continue to invest and continue to build like a strong pool fund at the global regional that the country level can coordinate and work along the lines to improve like all the 5 major components in overall. This could be continue the education, enforcement, advocacy, emergency response. It's some pillars still limited, quite limited. So we have to strengthen all those parts and keep moving to keep all this money. If we can save, this money can be used for another development sector. We can build more road, we can build more school, we can build more business center to grow the country and the regional economy, and that will be greatly benefit to save life, to invest the amount of money for this. So this is the main 6 pillar in the over last 10 years. We have 5 pillars, but within this year we at the National Road Safety Committee we have a major 6 pillar, and coming up with 53 main activity covering the 222 sub activity. So in addition to strengthen the first 5 pillars, we also include another focus to strengthen the safety vehicle management, and mainly focus not just only those normal vehicle, but the new digital transformation and the new technology of the electric vehicle, how to be safe. And we have to develop something in advance for the manual, for the guiding tool, for the safer EV to be transport on the road. So those are the major focus. But again, if we look back to the trend, I bring not just only 10 years for the last decade, but I bring all when we start the implementation program to introduce road safety program in Cambodia, starting in 2005, if I'm not mistaken, when I work at the WHO, and then we start to collaborate with the international, like Handicap International Belgium in that year, start to develop like road crash data system. So we developed this and then hand over to the National Road Safety Committee in 2010, that this will be integrated from the data from the police, the data from the Ministry of Health, combined together to generate all this. So I bring all the trend from 2005 to up to 2024. We can see some decline in the fatality and the injury in overalls, and the crash also slightly declines. However, we have a big ambitious. I know every country we have a big ambition to save life. Life is more valuable, cannot be counted in money. So that's why we have to pay higher attention. If you are in good health, but you are not safe on the road, it means that zero, nothing. But if you are a good health and then you also safe on the road, and this you will have a chance to grow and to develop your country, to grow your community, and to do something like more valuable to your country and the region and the globe. So I want to put these two important components to bridge together good health, public health, and safety. Must be two things to say together, not just something you talk separately, but two things to bring higher attention together, to invest at the same thing. Like if you see any other communicable disease program, very high attention from the development partner from the country, but while the NCD, non-communicable disease like injury prevention, including road safety, seem to be still neglected, not very strong attention and investment into that. So I want to bring this to bridge together, to marry between health and safety is the two major priority everywhere in the globe, not just only in our like the low middle income country like Cambodia and others, but everywhere. So in the 2024, recently the data is
Sorry to
very high.
interrupt, Suwan. So we already passed 17 minutes. If you could just conclude your presentation, that would be great. Thank you.
Okay, thank you. So I hopefully this presentation will be shared to the participant later on. Will be shared available to all. So I'm not going through this, but still going very high in 2024. And then the motorcycle road user is 80% of the fatality comparing to the whole cause of the fatalities. And many food delivery company, as you can see here, but we go to one case in from the news that they feel. So there is a small interview conduct to them. He was in the accident that he has to that he broke his leg, and many other cases. Some people die on the spot, especially at night when they bring the food or other thing to the client. So they die on the spot. They got injured in the accident, but it seemed to be like still limited for the healthcare and the response, who will be responsible to cover their medical costs. You can see a lady on the photo. They have to work hard because they think it's other additional income that they can generate. So they have to go with the kid somehow, but they have to drive the motorbike with a higher speed. And looking at the map on the phone, they put on the map on their motorbike. So it's very, very risky. And they do agree that it might be just a temporary job they do, but they have no choice. And they also, there is one team that they are like independent contractor working for those food delivery, and they go to advocate to get a better medical care and higher attention from the delivery company, but still no solution. And the National Safety Fund, National Security Fund, they also plan to include all those independent or the temporary contractor that they can pay their health insurance, like they have to spend about $4 a month or something, but might be very limited benefit if they got injury or got accident. So I think might be a program to advocate further for the safer, because they have to ride with the higher speed somehow. Although some intervention like we promote through the education platform, we provide a presentation to the group of those people, the delivery team, but we can see very limited result. To me, I'm still not really happy. Maybe we want to learn from the other country, or we have to talk more or initiate any piloting, how we can improve to ensure that the education plus enforcement and other like the new education technique will be engage them or give them some point if they can drive safer. This need to be participated by the company themselves together with those food delivery people. So to conclude, hopefully from this is just it's just starting point, and I'm looking forward to hearing from the others, and we can sitting down through many other platforms and event that we can generate some good piloting, like a good solution to address this emerging challenge in Cambodia and other neighboring country in the region. So thank you.
Thank you very much, Swan, for the fantastic presentation. So very, very insightful presentation. Great to see how you're progressing against your targets and how you plan to just reduce the number of fatalities overall and address the issue for motorcyclists in Cambodia. So we already have one question in the question and answer chat box. So that's from Michael. In the case of non-fatalities, are the casualties questioned as to the root cause of the accident, which is, was it distraction, vehicle not seen in time, excessive speed, for the conditions, etc.?
In the road crash data collection form, we have to field to tick whether it's caused by like overspeed or any distraction behavior. So the police normally will be arrived at the spot. They have to fill all those form, and then this also be able to do further analysis at the National Road Safety Committee that we can generate from those non-fatal cases, whether it's caused by what major factor. That could be a contributing factor, speed and cell phone use, because of food delivery. People normally high speed, and they have to keep an eye on the phone while they're driving.
Thank you. So we have another question from Krishna. In low-income or developing countries, what are the key challenges faced in registering private two-wheelers for use as service vehicles? This might be next factor, road crash.
In low middle income country or the developing country, yes, more are the two-wheel vehicle. Mostly more than the 70% already are registered every year is the two-wheel vehicle. So might be the good point how all the country initiate together how we can reduce the number of the registered two-wheel, but increasing the four-wheel, that some creates an ease and a benefit that affordable price, or they have to go with to work with other private sector with a special program, a long-term loan, cheaper interest, but they can be accessing to the safer approach on the roads. So might be good, because in the country, just many cases they have to use an old motorbike and put the trailer and loading many hazardous equipment and the truck carrying on the road from one place to another place. And this is also the major risk. But if we can promote the program by changing from using those two-wheel to loading high risk and hazardous object to the four-wheel, to put them properly in a trailer and closing properly, this also safer on the road to other road users.
Great. Thank you very much, Swan, for your presentation. And there might be more questions in the question and answer, and you will have the opportunity to just write down the answer to those questions or leave it to the end of the session discussion to discuss those questions. Thank you very much for your presentation.
My pleasure. Thank you.
Great, so let's move on to the second presenter. We are around 5-6 minutes behind the schedule now. So our second presenter is Dr. Rusty Rusli. And Rusty Rusli is a senior lecturer at the School of Civil Engineering, University Technology Mara, Malaysia. He earned his PhD in civil engineering with a focus on road safety from Queensland University of Technology, Australia. With over 20 years of experience in academia and research, his expertise lies in crash modeling, advanced statistical analytics and analysis, traffic engineering, and transportation safety. His work has been published in reputable journals and presented in both national and international conferences, reflecting his ongoing commitment to improving road safety through evidence-based approaches. He has led and contributed to numerous research and consultancy projects, including studies on food delivery rider safety, work-related road traffic crashes, and safety interventions on rural and mountainous highways. In addition to his academic contributions, Rusty is actively involved in professional bodies such as the Road Engineering Association of Malaysia, the Institution of Engineers Malaysia, and the Institution of Transportation Engineers, and the Institute of Transportation Engineers. His current research continues to support policy development and innovative solutions for safer road environments in Malaysia and the Asian region. On this note, I would like to ask Rusty to start your presentation, please.
Okay, thank you, Dr. Amir. Can you hear me clearly?
Yes.
Okay, thank you, and also the others presenters and Dr. Shane. Okay, there's a great opportunity for me to share what happens related to the food delivery riders in Malaysia. And my topic is understanding the challenges and the safety risks of food delivery riders in Malaysia. Malaysia, sometimes we call it food delivery riders as the P-hailing riders. Okay. So for these presentations, we share with you two of our previous studies, our current study about the comparison between characteristic of food delivery rider with and without crash experience during delivery in Malaysia. We do survey, questionnaire survey, and then the second one, I also will share with you about the risky riding behavior among delivery rider at the last intersection. This one we conduct a study on the field observation, based on field observations. And also I will share also about the development of international and Malaysian standards based on my experience and also others friends in Malaysia. And also I will share as well one of the program that initiated by the Social Security Organization Malaysia also to reduce the number of crashes involving food delivery riders. And lastly, the way forward. Okay, a little bit about introduction. I think my colleague Shuang already explained about the two-wheel crashes especially in the middle income countries and also Asian regions. And I little bit add about focusing about the P-hailing riders. For example, Malaysia e-commerce grew from 3.6 billion USD to 8 billion USD, which food deliveries sectors reaching about 9,956 million by 2022. We have little bit issue regarding to the crash reporting involving food delivery riders, because I need to share with you that in Malaysia, in the police report, when crash happen, they have no indicators to say that this belonging to the food delivery riders. We didn't have any special attributes in the police report to say that this crash involving food delivery riders. But based on the statistic come out with Malaysia Institute of Road Safety Research, for example, in 3 months, from the two big companies in Malaysia, Foodpanda and also GrabFood, there are 4 that reported fatalities, and then 55 serious injury and 73 minor injuries involved with food delivery riders. Okay, other study from the Korean and also from the Greece say that issue regarding to the young riders. And we know that most of the riders, food delivery riders in Malaysia are young, and they are more likely to run red light and skip the helmet use. And this, to risky behavior, we increase the crash ratio. And then based on the study by the Pramani in 2021, they found that 70% of the P-Henny rider or food delivery riders in Malaysia violate the traffic rules while making deliveries. Okay, the first study that I want to share here is about the comparison between a food delivery rider with and without crash experience. Okay, the objective to examine the characteristic of these two types of food delivery rider and how we define the crash experience based on 12 months, last 12 months crash experience. So what we're looking at in terms of general characteristic, for example, in terms of the age, job status, experience, income, working hours, and also distance travel for the every riders. And then also previous job, and either they have any traffic ticket histories. And then also we're looking for the road safety knowledge in terms of the vehicle servicing habits, in terms of safety awareness and mobile phone use while riding. Okay, this how we conduct this survey. We have a lot of collaboration with. They have one in Malaysia. They call it as Malaysia P-Henny Association, or they call it as the Pahanta. It's one association to as representative of the P-Henny rider in Malaysia. Okay, analyze whatever we analyze crash involvement, either involved or not, and then write the demography and job profile, safety knowledge, and behavior patterns. The variable we collected: age, job scope, delivery experience, monthly income, working hours, daily distance travel, previous job experience, traffic tickets, road safety knowledge, and mobile phone use while riding. And for this study, we do a chi-square test to compare between these two groups, and then support with the odds ratios. Okay, what we found from this study, first, of course, to support the previous study, we have also problem with the young riders. I think this might be due to the inexperience, lack proper riding skill, and also risk taker. And then when we compare between full and part-time riders, we found that a full-time rider have higher crash involvement. Okay, I think the main reason behind this might be due to them full-time they have only single income, because the delivery rider is their own income to the families, so that's why they need to rushing to get the, for example, the expected amount that they want to achieve every day. If they didn't get that amount, they need to work more than usual. Okay, and then more experienced riders have higher crash involvement. So increase the years of experience, we increase the number of the crashes involved, and this might be due to the less cautious when riding for the more experienced riders. Okay, next is rider traveling long distance. Also, I think this one is related to the exposure factors. We know that when you're more on the road, your exposure to the crash is also increases. Okay, rider with no previous job experience, okay, have more crashes compared to the without with the crash experience. So this is based on the experience, how you work and how you driving or riding with your box at the back. Okay, and we didn't find any clear differences between the traffic ticket, income level, working hours, mobile phone use, and motorcycle servicing habit between these two groups. A rider with previous working in the food and grocery sectors are the higher crash. Okay, this is only for the rider from the food delivery sector have maybe experience on that. Okay, we do a second study. Okay, this one is we do a site observation, and then this study want to identify to determine the factor influencing risky riding behavior among the riders, and we observe this at the signalized intersection. Okay, we do this study around the Klang Valley, Malaysia, and during the observation, we collect around 90,803 riders involved, in the 4 days, including weekdays and weekends. And then we observe 7 risky behavior, including unfastened helmet, not wearing shoes, incomplete set of side mirrors, red light running, mobile phone use, stopping after stop line, and also abrupt lane changes. And whatever we observe, we also observe the day, time of the day, weather conditions, intersection time, and approach route. Okay, for this study, we found that the highest risky behavior happen is stopping after the stop line. I think around approximately 44%. And we have initiative by the government to reduce this risky behavior. We introduced the advanced stop line. So either I think maybe the definition is the term also different. Sometimes they call it as the motorcycle box. You need one box before the stop line to make sure that the riders stop not more than the designated lines. So we give some space to the riders. Okay, the study also found that junction, T-junction, to stay with the helmet now used and also red light runnings. Okay, red light runnings and mobile phone use higher on weekends and clear weather. And we know that during weekend, the traffic in Malaysia a little bit low compared to the weekdays. So this number of traffic or the traffic characteristic or condition increase the red light running and also mobile phone usage. Okay, rainy weather reduce the risky behavior significantly. I think during these conditions, the riders mostly more cautious and then riding more carefully. Okay, in terms of development, how we want to tackle this issue. I think last 2 years, in 2023, I also involved in the development of the Malaysia standard 2756, road traffic safety, good practice for the platform providers in implementing work-related road traffic safety management. First, in this standard, we need to declare about the different entities in the key economy first. Okay, the key economy, including for example, how we define the platform providers. Okay, because we have some issue regarding to the law of the employers. In Malaysia, the platform providers didn't declare the riders as the workers. So it's not under the employers law in Malaysia. So what happened to the riders? The rider need to be responsible themselves. Nobody care about their social protection. So we need to understand this, and we put this all in the guideline to make sure that every parties involved in this industry know what they are and then what the responsibilities. Okay, and this guideline or standards, we also apply for the ISO as well. I also one of the committees for the International Standard Organization, also doing the same thing but in the international standards. But I think this one is still running. We just got the comments from all the peoples that conducted by the survey. The survey conducted by ISO is to get feedback from all the parties about these standards. Okay, and special programs that's also we have in Malaysia, and this one is initiated by the the social security organizations also in Malaysia. And with the collaborators from UiTM, my university, and also from MIROS, Malaysia Institute of Road Safety Research, very support and got a fully support from the Malaysia P-Hand Rider Association, PHANTA. And objective of this program is to increase rider awareness and knowledge of the road safety. Riders raise the rider awareness in the impact of the road accident. Because sometimes they didn't, because the accident is not happened to them yet, so they didn't have any kind of the awareness about what happened if the accident occurred. And then improve safety understanding of the traffic violation and road rules. Okay, we just to make sure that these riders know about what the traffic regulation and the traffic violations happen. Okay, promote understanding on defensive riding and insurance protections, and then improve riders' motorcycle control skills, including in emergency. Because we know that compared to the ordinary motorcycles, they have another ports in Malaysia. I think most of the country, Asian country, doing the same thing, designing. They put some ports at the back of the motorcycles, and this board they use to store food during the deliveries. So when we put another component at the back of the motorcycle itself is not stable. Okay, stable like existing design of the motorcycle. So they need to aware about this condition and need to know that how to make sure that the handling of motorcycle is in the good way. And for this, during this programs, we developed one, we call it as a module to make sure that every training have the same talk to the riders. So we got collaboration from police, the police in Malaysia who enforce the law, and then also the road transportation department as well. And also we have MIROS also join this in developing, join the team to develop this module. Okay, this module come up with two modules. One for the lecture one. Okay, so we give the explanation, we show the statistic, and we show the sequences. What happened if the crash happened? What the procedures that you need to know, and then we also increase the riders to make what we call it the personal protection to make sure that they have some insurance to cover if something happen to them. And then the second module, we go more to the practical one. So we expose the riders about the maintenance, the simple maintenance. Okay, how you want to check your, for example, your tire, how you check your signals, how you make sure that your motor can, what we call it, the can be used on that day for deliveries. And this is examples of the program that we conduct. We go to the many places around Malaysia, including Borneo as well, to conduct this training to all the riders. And then during that study, during that program, we also conduct an evaluation program to identify whether this program have some impact to their knowledge. So we do a pre and post test. So I think this based on the 5 location: Kota Kinabalu, Sabah, Kuching, Sarawak, Penang, Kota Baru, and Hulu Langat. And also here I also presenting the average of the marks, the percentage of the riders pass this riders answer questioning correct. Okay, so we have the significant knowledge before and after the program conducted. Okay, the way forward
All right.
in Malaysia.
So could you please conclude your presentation, Rusty?
Okay, this one, Dr. Amir. Okay, that's one. Okay, so what way forward? First, self-employment to the social security scheme in Malaysia. So we encourage the riders to they have some insurance to support that happen. And Malaysia government also has a very supportive, and they provide they support about around 70 to 60 to 80% of this cost. Another 20% is come from the riders. And then we also encourage for the skill training and upskill programs, and then the safety campaigns and the road safety awareness programs. Promote to use helmet, safe riding, and road awareness, insurance and protection awareness initiative, and encourage riders to register for the insurance and social security. And recently, we tried to form one we call it as commission for the gig economies. Okay, we know that food delivery riders also part of the gig economies. So we need one commission or one team that can go and identify what the issue regarding to this group of the workers, including the P-handling riders. And then lastly, industry engagement through the PAHANTA, Malaysia P-handling Rider Association. So they're very supportive to support their members from the different regions in Malaysia who are working as the P-handling riders. Okay, in terms of the welfare, in terms of the safety, and also in terms of policy issue. And currently in Malaysia, we try to make strongest the policy or the law regarding the P-handling riders. Okay, I think that's all from myself. From my side, I think I pass back to Dr. Amir.
Thank you very much, Rusty. Excellent presentation. It's great to see these insights around the parameters and characteristics of the commuters who involved in serious injuries, fatalities, and crashes in Malaysia. So that was very insightful. Thank you very much. So I do not see any question in the question answer box. If you have any question, please feel free to put that there. I just checked the chat as well. No, there is nothing in the chat as well. So I have a question myself. So that's about your study. So that was a great study that you have done. But you mentioned that the way that you did the study is through the surveys. So to what extent you believe that, because you do a survey with the people who were minorly or majorly injured because of the crashes, to what extent you think that that might create some bias in the results? Because many people who were involved in fatality crashes, they are not here to answer the question. So
Yeah.
how do you address that one in your research?
Okay, I think because I think that is the issue regarding to the questionnaire mostly happened to the Malaysian people as well. They didn't want to answer properly the question that we posed, especially when we have the many questions on the one set of the questionnaires. There is difficulties that we found here. But I think because this initiative, we give some tokens to the participant who involved in the survey. So we think that this questionnaire is quite valid, and we try to justify with the site observation. That's why we conduct the second study to observe by ourselves without the nose what the risky behavior that performed by this group.
Fantastic. Thank you for answering that question, Rusty. So I can now see there are 3 questions in the chat box, but we might have time to just go through maybe 1 or 2 of them. Oh no, one of them is just a compliment. Thank you very much, Krishna. But we have 2 questions from Krishnan. So the first one is, how do you distinguish between platforms and gig workers in regulations?
Okay, how this question between the platform and gig workers. So we know that for this study, my scope of study, we looking for the people who involved in the food delivery riders. Okay, not to the overall gig workers. Okay, for example, the second study, we of course we can identify based on their box. There's the main indicator for to observe either they are platform or gig workers. And in terms of the laws, we stay not. That's why we try to make increase the policy by propose a gig economy commission to make sure that we have some very clear definition about these gig workers and also platform workers. Okay, because what happened in Malaysia for the platform workers, they are workers. They are under the Employers Act. But for the PLM rider, it's different. They just declare as the partners. So partners is mean that they not are workers, but if something happen to the riders, the rider itself need to responsible, not the platform providers.
Great, thank you very much, Rusty. So my apologies, Krishnan. So it would be good to just move on to the next presentation because we just have 22 minutes and we have a lot of time. But I would like to ask you, Rusty, if you could just go to the question and answer and just type the answer onto Krishnan's question, that would be great. So while I ask Nguyen to just do the presentation.
Okay, thank you.
So let's go to the next presenter. So our next presenter is Dr. Nguyen Phuc. Dr. Nguyen Phuc is a senior lecturer in the Faculty of Bridge and Road Engineering at the University of Da Nang, University of Science and Technology, where he has also leads the Sustainable Travel and Economic Behavior Research Group. After earning his PhD from Monash University, Australia in 2018, he advanced his research career as a postdoctoral researcher at the Singapore MIT Alliance Research and Technology. His research spans traffic safety, travel behavior, transport modeling, transport economics, and sustainable transport, resulting in over 60 publications in leading international peer-reviewed journals, quartile one, and an H index of 29. Several of his papers are among the top most cited articles in top tier 8 star or A journals, highlighting the significant impact of his work on both theoretical advancements and the practical implications in industry and policymaking. In 2019, he was awarded the prestigious Sidra Solutions Award, recognizing him as the most outstanding postgraduate student from a tertiary institution in Australia and New Zealand. An independent Asian review of motorcycle studies in 2024 also acknowledged him as one of the two most influential authors with a substantial local impact in the field. Furthermore, Dr. Nguyen Phuc has been honored multiple times with the Certificate of Merit for Outstanding Researcher by the President of the Da Nang City Council and the University of Da Nang, attesting to his exceptional contributions to research. He currently serves on the editorial board of several leading academic journals. I would like to invite Nguyen to start his presentations, please.
Thanks, Amir. Hello, everyone. So today I would like to present a topic that related to the food delivery motorcycle rider, especially focused on the factor affecting the risky riding behavior among the food delivery motorcycle riders in Vietnam. So this is I don't need to go through these slides because Amir helped me to do it. So first one, I want to introduce the research context. This means that we can see in Vietnam, so the rapid growth of food delivery riders for the last decade. So you can see the Vietnam traffic is very complex and motorcycles dominate the traffic flow. So with the rapid development of the technology, So you can see there are many new transport modes and services have been introduced for the last few years. For example, the technology-based taxi service or the food delivery services. And plus to the COVID-19 pandemics have transformed the transportation pattern. So you can see the rapid growth of the technology-based food delivery service in Vietnam and in other developing in the ASEAN, especially the food delivery by motorcycle. This is the highlight of the development of food delivery services in Vietnam. So it's 2010, you can see the traditional phone-based delivery service. But after 5 years, so the first app-based food delivery service was launched. We can see this is the Shopee food servicing. And after 3 years, the Grab Food introduced the service in Vietnam. And during the COVID-19 from 2020 to 2022, so we can see the bomb in the demand for the online food delivery. So you can see because of the convenience, so the habit of ordering the foods online among Vietnamese people so have become more and more popular, and it's not until now. So we can see more until now there are more than 30 million customers, and you can see the market because to nearly 30% of the Vietnamese people order food online 1 or twice per week, and 20% order 3 and 4 times per week. This is a high number. Let's move into the market share. So in 2024, we can see the market reached nearly nearly 2 billion US dollar, and it's up to 24 compared to the last year. So Vietnam leads the growth of food delivery services in the Southeast Asia. And it expected we can say it's expected to reach nearly 9 billion by 2030 US dollar. And we can see the trends of the food delivery riders. Most of them are transferred to the electric vehicle to reduce the fuel cost, and you can increase the income. And in the next few years, you're going to see the expansion in the rural area and the second-tier cities. This is the trend of the food delivery services in Vietnam. There are several challenges faced by food delivery riders in Vietnam. The first one, they have to deal with customer because the customer have the high expectation for the speed and quality. So if we do not adapt with the demand, so they can give you the negative reviews and affect directly in the income. The second challenges faced by the riders is that related to the platform. We can see the high commissions rate and the less of the welfare policy, for example, the insurance or the support from the hit company. And the last challenge is I want to mention here is the traffic safety, because they have to work under the high pressure, so they have to they often have to engage in the risky riding behavior, for example, speeding or red light running. And a high percentage of the food delivery rider in Vietnam have the poor traffic knowledge. So this is also an issue. So I want to mention about the first problem with the rider, the food delivery rider. So the traffic safety. So we can see with the number of food delivery rider increase over the last few years, so we can see there are many safety issues related to this type of services. And we can see the high record of the number of traffic accidents related to the food delivery rider. And the main cause as I mentioned before. So because they use they engage in the risky riding behavior, for example, using mobile phone when they deliver the food, because they want to check the order, they want to check the dress of the customer or something like that. So this behavior is very frequently, and they lack of the training and the traffic awareness. And due to this one, so the consequence is to increase the crash rate and reduce the service is made. And the second problem is that in Vietnam, so we can see that there is a pooling between the science and policy. So especially with the rapid development of the food delivery service, so the government do not have the good policies, because they do not do any because they do not do the research and use the result of the research to develop the policies, and we lack of the reliable data and the tool and the service to develop the traffic management policy as well. So this is the second problem that I want to mention here. So because the problem, so there is a need to conduct some study related to the risky riding behavior of the food delivery. So this study is needed because it helps the government to have some evidence to develop an effective policies. Due to the demand of this study, so our research group have conducted some study related to topic, and we focus on the urban area in Vietnam, for example, Ho Chi Minh City and Hanoi City, and we focus directly on the motorcycle delivery rider. The object of our study is focused on explore the key factor that affect on the risky riding behavior among the food delivery rider. This is some before doing the research, so we have go through the related study, and we can see that there are some study related to the food delivery rider that have conducted in Asia, for example, the Korea, the China, and Malaysia as well. And the study focus on exploring the human factor and other factor, for example, the environment factor that affect on the risky riding behavior. And we found some research gap, for example, the lack of strong theoretical foundation, work-related psychology factor are often overlooked. No previous study on this topic in Vietnam. And based on research gap, so we decide to conduct some study and using the quantitative research approaches to do this. And we decide the paper-based questionnaire and collect the sample directly from the food delivery rider. And the method that we use to analyze the collected data is the structural equation model. People say this is the same model. In this presentation, I try to go quickly two models that we have to develop. The first one, we develop a model based on the job demand model to explore the factor effect on the risky riding behavior. For example, the job demand, the job resources, personal demand, and personal resources. And we include the perceived risk safety and the job burnout in the model as well. So after decide this model, so we try to focus on a specific risky riding behavior that more of the rider engage. This is the motorcycle, this is the mobile phone use frequency. And this is the second model. In this model, so we use the structural equation model approach and integrate it with the ANN approaches as well to increase the precise of the result. When we have the model, we come back to decide the questionnaire. After we have the questionnaire, we will build a survey team and training them to collect the data. And after that, we collect the data and we have to use the data and we have to use some specific tool to analyze the data and have some result. So this is the questionnaire that we use to collect the data from the rider. So this is quite long, but we have some strategy to implement to collect the data from the rider. And this is the result of our survey. So we can see more of the food delivery rider in Vietnam are male, and we can see the full time and the part time is quite equal. And for the model one, we can see some factor effect take on the risky riding behavior. So after running model, so we can find some dimension of the job demand, for example, the time pressure, the work-life imbalance, and the working environment that will affect on the job demand. And for the job resource, some attribute, for example, the social support, work authority, rewards, and feedback will form the job resource. And this one will affect on the burns out, and from the burns out have directly effect on the risky riding behavior. So if you want to have the detail of the result, you can go to the paper and you can read this paper. And you can understand more about the how we interpret the result and how we use it to propose the policy for the government. And for the model two, so we can see this is some primary factor that affect on the frequency of using motorcycle among the rider. And we run the model with the SEM approach, and after that we integrate with the ANN method to find the factor that affect on the frequency of using mobile phone between the rider. For example, we can see the safety risk, the social support, work autonomy, and rewards will affect on the frequency of the frequency of the mobile phone use among the rider. This is some detail of the result, and you can find more detail by reading this paper. And when we find the result, so based on the result, we can find the factor that affect on the risky riding behavior, and we can use the evidence to develop the policy that try to reduce the engagement in the risky riding behavior among the rider and reduce the traffic crashes. So this is some example. For example,
if you could just conclude the presentation, that would be great.
Yeah. Yeah. Thank you, Amir. Yeah. So this is some policy that that we propose for the government to reduce the traffic accident related to the riders. Okay, so this is the conclusion. So we, by doing the research, we develop a predictive model for explore the risky riding behavior and consider multiple influence factor. And we introduce the novel approaches to explore this topic as well. So thank you for the listening. Thank you, Amir.
Thank you, Nguyen, for the fantastic presentation. It was great to just see the issues you encountered, the type of solutions you proposed, and the fantastic analysis that you did at the end, to find out the factors affecting the using mobile phone, what people are riding. So that was very insightful. Thank you. I can see
Thank you.
one question from Krishna, which is in the chat. So she mentioned that since riders may perform multiple tasks, such as delivering online orders or transporting passengers depending on peak hour, how did you account for this in your data sampling? Additionally, could the operational efficiency of two-wheel vehicles be another influencing factor, or are these some oh, maybe these are the limitations, or these are the limitations. Thank you. So can you please respond to that question, Ian?
Can you respond, because I do not hear clearly about the question.
Sorry.
Hi, Amir.
So would you like me to read the question again?
Yeah, please. Yeah,
Well,
because I cannot hear you
chat
clearly.
box, if you go to the chat box if you can just see the question, that's the last one. But I just repeat that since riders may perform multiple tasks, such as delivering online orders or transporting passengers depending on the peak hour, how did you account for this in your data sampling? So maybe let's go for the first question first.
Okay, so in Vietnam, so there are some services that provide the food delivery service. Some, for example, the Grab. So the rider can do the dual task, for example, transport the passenger and delivery the food as well. So when we do the survey, we can ask them to focus on the food delivery task only. It means that they have to stick on this task and they answer the questions based on the task. And for the service, other services, or for example, the Shopee one, they just provide the food delivery service. So for this rider, so we just ask them to respond the questionnaire only. Yeah. So this is what we did in the field survey.
Thank you very much, Nguyen, for answering that question. There are a couple of more questions that you can respond to, Krishna, maybe in the chat if you have a look at the other two questions. Now we are
Yes,
just
sure.
approaching 5:30. So we are approaching 5:30, and now maybe my apologies, we couldn't find the time to do the final sort of discussion but we had three fantastic presentations, very insightful presentations, and the discussions afterwards. So since we reached 5:30, I would like to conclude this meeting. But before conclusion, I would like to remind you that this session has been recorded and will be available in YouTube channel and also in the Australasian Road Safety Conference website. So you can just get access to it once it's available. So I think they will send a notification once it's available. And also, I would like to remind you about, as Shane mentioned, about if you would like to join the college, Australasian Road Safety, that's a great opportunity with $10. You can join as the international members, and that would be a good opportunity for you. At the end, I would like to thank you for attending this session, for the great contribution, and also thank the presenters, Swan, Nguyen, and Rusty, for the fantastic presentations and insightful slides that you provided, and also thank Shane for sponsoring this session. Actually, that's Shane and International Outreach Chapter. So on this point, I conclude this meeting and wishing you all a great weekend. Thank you very much, everyone.